Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question about dermatology. A 25-year-old man presents with a pruritic skin rash. This has been present for the past few weeks and has responded poorly to an emollient cream. The pruritus is described as intense and has caused difficulty sleeping. On inspecting the skin, you notice a combination of papules and vesicles on his buttocks and the extensor aspect of the knees and elbows. What is the most likely diagnosis? A. Lichen planus. B. Chronic plaque psoriasis. C. Henoch-Schönlein purpura. D. Dermatitis herpetiformis. E. Scabies. Okay, here we have a 25-year-old man coming with a pruritic rash, which has been present for past few weeks, and there was no any response, or there was a poor response to emollient cream. The pruritus is described as intense and has caused difficulty sleeping for the patient. On inspecting, we can see combination of papules and vesicles on his buttocks and the extensor aspect of the knees and elbows. According to the sign and symptom and presentation of the lesions, their most likely diagnosis here can be Dermatitis Herpetiformis. Here we are going to explain about it. Dermatitis herpetiformis. Dermatitis herpetiformis is a chronic, intensely itchy, blistering skin condition caused by an immune reaction to gluten or protein, which is in wheat. It is caused by deposition of immunoglobulin A in the dermis. It is considered the skin manifestation of celiac disease and is strongly associated with gluten-sensitive enteropathy, even if gastrointestinal symptoms are absent. Causes and pathophysiology of celiac disease or dermatitis herpetiformis trigger ingestion of gluten or protein in wheat, barley, and rye. In genetically predisposed individuals or individuals with HLA-DQ2 or HLA-DQ8, gluten triggers an immune response. The body produces immunoglobulin A antibodies against gluten-derived peptides, and this is the cause of their pruritus and the lesions on the body skin, on the patient's skin. These immunoglobulin A antibodies cross-react with epidermal transglutaminase or ETG in the skin. Immune complexes deposit in the dermal papilla, leading to complement activation, neutrophil recruitment, and blister formation. As we said, it's caused by deposition of immunoglobulin A in the dermis and the results of the disease. Features: clusters of small itchy vesicles, papules, and urticarial plaques on the extensor surfaces, example elbows, knees, and buttocks. Herpetiform refers to the grouped vesicles, not their herpes virus. It's important. It refers to the grouped vesicles, not their herpes virus. Here we can see the lesions of dermatitis herpetiformis in the knee, buttock area, and the elbows of these patients. Diagnosis of dermatitis herpetiformis: skin biopsy, subepidermal blister with neutrophil-rich infiltrate at dermal papillae. Direct immunofluorescence, we can see granular immunoglobulin A deposits in dermal papilla, and direct immunofluorescence is the gold standard of diagnosis in dermatitis herpetiformis. Blood tests, we can see elevated anti-thyroid tissue transglutaminase, immunoglobulin A, anti-endomesial antibodies, and anti-ETG antibodies. In small bowel biopsy, we can see villous atrophy, which is the common presentation in celiac disease, but not always necessary for dermatitis herpetiformis diagnosis. In dermatitis herpetiformis diagnosis, direct immunofluorescence, which we can see granular immunoglobulin A deposits in dermal papillae, is a gold standard for diagnosis. Management of dermatitis herpetiformis. Strict lifelong gluten-free diet improves both skin and intestinal change, reduces risk of associated complications, example lymphoma, medications for symptom control. Dapsone is a first line for rapid itch relief and works within days. Dapsone is very important in the management of the dermatitis herpetiformis. Alternative, sulfapyridine or sulfasalazine for those intolerant to Dapsone, and monitoring is important. Usually regular blood tests to check for Dapsone side effects, example like hemolysis or methemoglobinemia if the patient is taking Dapsone. Monitor for nutritional deficiencies like iron, folate, B12, and vitamin D is important because the deficiency of these vitamins is common in patients with celiac disease. Prognosis is excellent with gluten avoidance and appropriate medication. Skin lesions usually resolve completely with treatment, and persistent gluten exposure increases the risk of intestinal lymphoma, and this is very important. The persistent gluten exposure increase the risk of intestinal lymphoma, and the patient must be aware of these risks. Okay, here was a short explanation about dermatitis herpetiformis presentation and management in dermatology field. Thank you for your attention.